Number 3, the sleazy salesman technique. Book in now for a discount. Don't miss this once-in-a-lifetime opportunity to book in for your hair transplant procedure. Getting a hair transplant procedure is not the same as buying a discounted pair of shoes from your local market. This process is not something that you should be rushing into. If a clinic is advertising last-minute discounted procedures, then this is the red flag in itself. Having free spots last minute and not being able to fill them with patients that are on your wait list means that this clinic already doesn't have a strong foundation. In Australia, the medical board has actually made it illegal to use these kinds of sales tactics. You are not allowed to create a sense of urgency when it comes to the advertising of surgical or medical procedures. Number 4, the overpromise and underdeliver. Many clinics claim to give you max density before they even assess your suitability for having a hair transplant procedure. In my practice, I've performed many corrections for patients who have low density, poor angulation, or just simply poor surgical planning. During your hair transplant consult, you should be assessed for your suitability to have a hair transplant procedure. This should include a full medical and surgical history, a root cause analysis of your hair loss. Is this pattern baldness or is there something more sinister going on? Performing a hair transplant procedure when you have an underlying untreated medical issue can result in most or all of your grafts dying, meaning that you will never get that chance again, or leaving you in a worse off position. Your donor capacity versus your recipient area. Do you have enough hairs in your donor region to recover what you've lost in your recipient area? If not, then how can we proceed? Do we sacrifice density? Do we need to have multiple hair transplant procedures? Do we need to utilize other techniques such as SMP or harvesting from your non-scalp donor regions? Are you being sold what you need, or are you being sold what the clinic can deliver? Is the clinic considering long-term planning? Have you been given education around the progressive nature of hair loss? If you've experienced hair loss now, then more than likely you will continue to experience hair loss in the future. Have you been educated on the use of medications to stabilize your hair and stimulate hair growth? Have you been educated on the density of implantation? Have you been educated on how many donor hairs are going to be left over or left in the bank for a rainy day in the future? If you continue to have hair loss, then more than likely you will need to save some hairs in the bank for future hair loss repairs.